Hello and welcome to Analytics. In this video, we are going to show how to present the results in a multidimensional cross tabulation. I'm just going to use an example of, the medical practitioners who normally come and say, we normally take these images and we say, for example, use, two different types of machines. We can use an MRI, and normally that's how it looks. And we can also use a CT scan machine. So in this situation, they can come and ask, I would like now to help me just understand, the patterns in the patient data that you normally collect. So let's say, for example, now this is now the data, that has been collected, for the CT scan, and then for the MRI scan. These are the results now that they got from there. Normally, they will also ask and say, we do have these patients. Some, we can diagnose them with, these two types of stroke. Now, what I want to know is I want to see, the cross tabulations. In terms of what is it that we got from the CT scan and MRI scan. Remember, the MRI scan and MRI scan and the CT scan, they actually do something similar, but one can be actually able to detect more information as compared to the other, and they can say, okay, no, we just want to see how we are performing. So in this case, let's just go ahead and see how we can show that kind of information. Usually it will be in some cases easier just to show these two in a just cross tabulation at 2 by 2, but now they will say, I would like to see this with two more extra variables. I would like to see how we performed in comparing CT scan and MRI scan and the CT scan results, and also how we eventually be able to, have, patients with ischemic and hemorrhagic, strokes. So in this situation, let's just quickly show how we normally do it in a simple cross 2 by 2 cross tabulation. So in this case, let me just say, if I just do a cross tabulation of CT scan, so let me just put here the CT scan, that is 21, and let me just do a cross tabulation with the MRI. So usually I'm not going to explain much of these other steps. I need to head straight to the cross tabulation. So I'm not selecting anything here. And let me just quickly have the table. So in this situation, you'll find that, just keep continue with this, the defaults. So this is like the usual table that one we normally, have in a 2 by 2. Yeah, one is able to say, okay, now for the MRI scan, the negatives, we had, this 23 and the positive were 17. And for the CT scan, 22 were negative and 18 were positive. And both they picked up 22 that were negative, and actually all of them, they picked up these 17 that are positive for the MRI, but now there was a discrepancy there. So, but in this case, this is what you're getting, but they will add another layer of complication to say, I also want you to add into the same cross tabulation. I'd like you to also show me, these two types of stroke. So in this situation, let's just go ahead and see how we can now provide that answer. So this normal cross tabulation may not be easy to show. So in that situation, this is what we can do. Then we can just go back to our data here and actually select all the variables. So this medical practitioner might have said, I need to know the information about the both scans, and I need also these two types of stroke. So now let's take 21 to 24, these variables that are of interest. And in this case now, we can go ahead and see how then can we answer that question. So let's proceed here. We're just going to present it graphically so that it's easier now to explain what is happening. So in this case, I'm not selecting anything. We continue now. We're not going to actually present this in a tabular form. So we'll actually go via the multi-dimensional approach. And normally the alluvial will be able to help us answer that question. We don't need to rotate anything in the meantime. So here it's just showing that we have included 4 of these variables. So let's continue here and go ahead with the plotting. So, okay, so it's just picking up some of these things. We can explain this in another video. For now, let's just go with the default. Let's continue. Now here, remember the medical practitioner might be saying, remember this, we can use this example, using any other data as long as, we know what you're trying to show. Here I've just chosen just to use, the medical data. So for example, now here, when we present that, we want to show all our information in the form of percentages. So here I'm saying all, just to say I want to show percentages for all the variables. So we proceed, and I can choose to say, okay, the percentages, where do you want this to appear? It to actually make more sense when you show the graph. For now, I'm just going to say, please position all these percentages to the right. So when I click this, and then it shows this graph here, which is alluvial. So let's just go ahead here and see. Let me zoom this. Right, so this is basically what will happen. Now we need to answer this question now, where now the medical practitioner is asking for, I need to know, how we performed with the CT scan and the MRI. Now we can see from here that these 55, basically that's 55%. If you take this actually flow here from here and all the way to the end, right in the bottom right hand corner, you find that N is actually standing for the number of patients in this case that are included. The T is equals to 4 is just for the trades. So it's like how many different groups of patients are we having here with similar characteristics. So which means we had 22, which is actually this big belt here, and then followed by another 22, which is actually this blue color here. And then the paper with also 5 with similar characteristics. And there was 1 here who actually had this also characteristic. Then basically this is how we then answer the question. So which means here we are able to tell if we say, okay, fine, what percentage of these patients actually showed negative in both the scans, CT and MRI, then we're able to tell that's 55% of them, and that's equivalent to 22 out of the 40. And now these 22 actually, all of them, they had no stroke. And then if you look into the blue one, we are able to tell there was another group of 30 patients. Now they were positive, for both. Both the results from the CT scans and the MRI. And now these actually, they had ischemic stroke, but here the results of the belt, you can see that they had no what? Hemorrhagic stroke. So there were 12 of those. And then we've got another group of 5, basically here, these 5, the equivalent to 12.5%, both, machines, they indicate positive, but it is actually the opposite of the previous results, where these actually did not indicate ischemic stroke, but now they indicated positive. They had actually hemorrhagic stroke. So this number of patients could have been maybe 100 or 1,000. So by just having this type of graph, we are able to quickly, provide that answer. So in this situation, that's basically what we can also use to be able to present, or describe something that we normally do in a 2x2 cross tabulation, but we can actually even have many variables that we can cross tabulate, and we can present that in the form of an alluvial diagram. So for now, this is what we just presented. And we'll see you in the next video. Thank you.